Hi, I'm Cynthia Schiller. Please like and subscribe. I just did a video on Munchausen syndrome, which is also called fictitious disorder imposed on self, because you can do it on yourself. But we're going to do the one by proxy. So Munchausen syndrome by proxy, which is commonly called now fictitious disorder imposed on others or fictitious disorder imposed on another. So we're going to do the proxy on others. And what exactly is that? Because there are some narcissistic traits. The person who gets diagnosed with it is the abuser. So it's not the victim who gets the syndrome. That can be a whole different thing with the child abuse and how that child, or if it's an elder that they use or a sibling, they might have some different type of mental disorders or illnesses that were caused by Munchausen. But people will often, the abuser will fabricate all these different diseases upon a person. And it's usually children. Children are often victims of child abuse because they're children, if you caught that. But they're victims of abuse because you have more control over them. They have to rely on you for food. They don't know what's quite normal yet, especially if they're little. They're told not to talk back. You can threaten them, not that you should, but a lot of times the abuser will abuse the child to get some kind of supply. They want to be seen as like this phenomenal person who's a great caregiver. They want to keep the conversation surrounded within them, where people are talking about them or stopping by, bringing meals or praying about them, to where they're now the center of attention. And that can often happen because the abuser, who is usually more often a female, but it can be a male, but it's usually because of some illness or injury that they received or saw as a way of getting attention. So even if, let's say, their mother had breast cancer and they saw, wow, everybody was there for my mom, like that might work, I can fake that. So they use a child to do it because they don't necessarily want to harm themselves. So they'll harm the child by giving them fake illnesses. They can cause the certain symptoms so they can take the child to the hospital, so they can have medical records. So what they'll do is they'll, have vomiting induced, whether it's through, kind of like food poisoning or even straight up poisoning, syrup of ipecac, which will make you throw up. They can cause diarrhea, maybe put some X-Lax in brownies, so that way the child, is pooping, upset stomach, passing gas, loose bowels. They can even cause seizures if they use the wrong medications for these children, just to make them sick. Sometimes they might even lie that the kid had a disorder. And I'm going to do a video on the movie ACT. And it's a story where the abused was about to kill the mother. I got to dive into it more. I don't think she did kill the mother, but I think she was about to, just because she was wheelchair bound and had a feeding tube when she was able to eat. She had different surgeries, and just the mom messed with it. So I'll do a new video on that when I research it more. But it's a really sad thing to destroy often a child's life or an elderly helpless person, or somebody you can just manipulate and lie to the medical professionals. They can even lie about cancers, chronic disease, just serious health conditions, stomach problems, blurred vision. They might mess with the kid's eyes, putting eye drops in that'll mess them up. And they just do that for their own supply, their own need. They totally disregard. And we're just going to call the abused, it's just easier, we're going to call the abused a child, even though it could be different ages. It can be a boy, girl, doesn't matter. But the narcissistic traits within this Munchausen is by proxy is that the abuser does not care what they are doing at all to that child. They don't care what it cost. You know, if the state has to pick up the cost of it. I don't know exactly how it goes. My dad had his leg amputated, has leukemia, things like that. But I think there's some threshold to where once you reach a certain threshold, you know, it's completely covered. It's like a catastrophic type illness. So if they keep building this stuff up, you know, it gets paid for. So they don't care who pays for it. And, you know, the life that the child is missing out on, the playtime, because maybe they're like, no, can't come out today. Oh, has a really high fever, and it's just all lies. And the kid's missing out on life. The kid's kind of possibly even scared, am I going to die tomorrow? So it's going to start causing some inner things within them. Maybe now they do have a stomach that's upset. Maybe now they are wetting the bed because they're scared to death. Their stomach might develop ulcers or acid reflux. So according to the Psychiatric Times, okay, 30 to 70% of those who falsify illnesses in children will also do that to themselves. So many of these mothers can also describe that they've also used this upon themselves. They don't always do it where they're the ill person too. That act one, she just totally used the daughter. So it's pretty rare. 1% of people in general medicine will reach this criteria to be a person who can be diagnosed with Munchausen by proxy. Unfortunately, there's not always reliable statistics because of all these lies. And, you know, sometimes they might keep it in, I don't know, let's say they're Jehovah's Witnesses or maybe Amish, or somebody who I don't know that much about Amish, but where maybe they don't utilize medical facilities, so it goes undiagnosed. They can kind of just make up some stories. They don't need medical documentation on it. They just had the whole community caring for this person, where their abuser is never alone. Somebody's always popping in and out. Or you might say, I need help. You know, I have to bathe her twice a day because, so, you know, you're having people coming in twice a day and you need help feeding them because of whatever. So the children suffer from this, and it can affect a lot of times young adults. And to be able to spot this, because sometimes we can really save the day for somebody. We can really notice the symptoms and kind of call people out. So if you see somebody lying about the child's symptoms, where they're like, you know, they can't play on the sports team, they have a bad ankle. Do they really? Like, the kid's running, you know, or the kid's really lethargic, and I just don't know what to do. And it's like, the kid's running around, it's not lethargic. So watch out for any tests that are manipulated. You know, are they asking, you know, somebody for, you know, let's say it's I don't know, a diabetic, to where they can prove that, you know, the blood sugar is off. They can put urine in a sample of, I'm sorry, blood in a sample of urine. If they falsify medical records to where they're trying to prove something's wrong, but you can see through that it doesn't match up. Let's say they use a, I don't know, jaw joint problem, and it's like, they would say temporomandibular joint problem. They wouldn't say jaw joint. So sometimes you can see through that way. Also pay attention if it looks like they're starving the child or victim, because maybe they're trying to say, you know, that they're trying to prove through weight that the person's suffering a terrible, deadly illness, and they're just wasting away. Well, they're wasting away because you're not feeding them. Sometimes they might inject them with feces, which is poop, to increase some toxicity, some infection within the body. They can poison, suffocate, it cause bruising, that they can say, the kid passed out, fell down the stairs, like bashed their head in, like, I don't know what to do. And, they're having seizures. It's so sick what they do to these people, to the extent that it could actually cost them the victim's life. And it's all just for attention to the abuser. So like I said, it's usually a mother. Often it's a female between 20 and 40 years old. A lot of times, this is what's crazy, is it could be often a healthcare professional. For one thing, they know the ins and outs of the different diseases. So they think they're sly, they think they're slick, that they can just manipulate certain things. They know what tests. So, they can sit there and be adamant, well, let's try an EEG. Well, that didn't work. Maybe we need to do an echocardiogram, or what about, ultrasound or MRI. And they're like, we have to do this, we have to do this. And it's just for attention. And, they might break down, like, I have to, this is my only child and you have to help me. And they just want like the attention, like sitting in the waiting room, like, yeah, like, this is what's going on. And it's all a made up story. They just want to often have the worst story. Like my daughter's has, I don't know, stomach ulcers where she's like bleeding all the time. And then somebody else in the waiting room might say what's going on with their terminally ill person. So now all of a sudden, the abuser is going to make up some more things. It's sad what they do. So they will seem really concerned. They'll come across as a concerned parent or caregiver. But it seems, that they like being around the healthcare professionals. They'll often talk to them. So, pay attention to that. Are they having conversations more than normal? Are they, it gets tricky because, if there's something really wrong with my daughter, I would ask a lot of questions. You got to be smart about things when things aren't overlooked. Double check things, is it making sense? Be proactive. But the Munchausen, when they're going through the treatment, when it seems like it would work, all of a sudden they're adding on new symptoms. They're changing their stories. They start to get angry if the doctor tells them nothing's wrong. And I don't know, it's sad because it's hard to spot. And that's why we don't know exactly how many people have this, how many people do it. Because I know when I was growing up, I worked as a telephone operator, and it's back on the switchboards where you kind of plug in. And it was really filthy there. There was so much dust, like there was just dust everywhere. But I was 16, and so I'm doing this job, and I ended up getting mono. I don't know if it had anything to do with the place I was working in, but I couldn't continue working because my throat had closed up so much. Worse sore throat, and didn't feel good, super tired. So I go to the doctors, and yeah, it was the ER. No, I can't remember. I went in. I can't remember where I went. It was a family doctor, so I must have just gone into my family doctor. That's how it goes. I remember now. Went into the family doctor, and he's like, I'm not even going to look at you. He told me that I had like a mental illness or something. I needed counseling or something like that. And he's like, there's no way somebody your age should have a file this thick. And he didn't know that I was a burn victim, that I had stitches 7 different times. I had to have a couple surgeries, a lot of broken bones. I was very accident prone. So, you know, it seems like that, you know, did I make it up? I definitely didn't make up my barbecue exploding when I'm 5 years old. My parents didn't do that to me. It happened, you know, and I even now I'm accident prone. Just dumb things. I'm 6'1", loose ligaments. So my ligaments, sometimes my knee will go out, but you gotta, you know, sometimes the doctors get fed up with people telling stories. So when I'm telling him something's wrong with me, he doesn't even want to hear it because they're so used to it. It's like, whatever, a teenage girl, attention seeking, things like that. So he just dismissed it. And I ended up in the hospital because the ER, because I couldn't even swallow. I did a blood test. I had mono. And the doctor said that was the worst case of mono he'd ever seen. He was a younger doctor, but that's what he said. But I was frustrated because, you know, here it says one of the things to watch out for is if somebody gets angry, if a doctor tells them nothing's wrong. So be careful on that, because I had a legitimate reason where my he didn't even look at what my medical records were, you know, and he didn't do any testing. You know, he just told me that things were wrong. So, you know, it's a tough balance. But if, you know, the doctors have gone through test after test after test, and there is no evidence, you know, he didn't even look at my throat to see what my throat even looked like. You know, that's when you get wrong, a little upset. But if they've done every testing possible, and they're still getting angry, it's kind of a red flag. So check the person. Do they have a problem with their self-esteem? Are you seeing little things about that? Are they acting upset? Like we have to figure this out. Like they're in this panic stress mode, and then it's like, you know, once the door closes, or I don't know, doing something on FaceTime or Facebook or playing solitaire, they're totally chill, but then upset at other times. So it's hard to diagnose this, which makes it so difficult. And it's hard to know how many children have been abused, or elderly, or others. And, you know, if we see that the child has multiple hospitalizations, like, you know, I did, but there are some where it's legit. Was it a cancer patient? Or this is where it gets tricky. The Munchausen by proxy, they'll have the medical records, but often the symptoms don't match up with the tests. Just a strange set of these symptoms can't really easily be understood or identified. It's not making sense to the doctors. So parents, if those are the abusers, they'll keep saying, oh, things are getting worse, things are getting worse. And they keep bringing them back and forth to the hospital. They keep wanting, you know, whether it's to admit the child to the hospital. That way, you know, they get the pity. The abuser gets the pity, like, oh my gosh, you know, we'll be praying for you. We'll stop up at the hospital. They can count how many flowers they got. Like, ooh, I am cared about because I have a great kid. They'll have, you know, CNAs, or they'll have, you know, different doctors and nurses or caregivers coming in and out. Your hematologist taking blood. You know, there's just always somebody to talk to. And that's the thing, like with these mental illnesses, is sometimes they just can't be alone. They need this supply somehow. And that's kind of narcissistic in a way, where they're just dismissive of what they're doing to the abused, you know, who's paying for it. You know, if the test comes back negative, they're gonna, but maybe we forgot about this symptom and they'll add on symptoms. So pay attention if there's any chemicals, foreign substances inside this child's urine, their blood, their fecal matter. A lot of times you'll see an eagerness to do additional tests or procedures. It's just to keep the ball rolling. I know I'm not crazy about having a blood test. I'm not crazy about coming back for an ultrasound or things like that. But the abuser will be excited about doing those things. And the test results, you know, can sometimes be unusual. They don't match the child's condition and symptoms. It's sad that they can sometimes poison them. So, sometimes even though they keep being told that the kid's not sick or the abused is not sick, that they're still insisting it. And one thing is you can see how often they've gone to different doctors because once they've used up that supply, just like the narcissist, once they use up a supply of doctors who are like, look, we've done everything we can, they'll just go somewhere else. And watch out for some surgical scars. I'm going to do that video on that act where the mom had the feeding tubes put in, surgical procedures done, and just ruined somebody's life and almost cost her own. Like I said, I got to delve into that. I can't remember if she actually did kill the mom. She was about to. I'm not sure on that one. But there are underlying causes. Some research are still trying to figure it out. This is kind of interesting though. There is an MRI, which is magnetic resonance imaging, like a brain scan. It can go throughout your body, but they can do it either just on the brain structure of some patients to see if it has biological or genetic factors. There'll often be a history or neglect when they were a child. And just, did they have a difficult childhood? How was their relationship with parents? That's like the key thing right now, is what they're leaning towards as one of the main instigators. And sometimes it's weird. They'll have overwhelming feelings of guilt. Like the narcissist will have this too. They'll feel not good enough, or they failed, or they could have done better. They're just not worthy. So inside, it's a weird way that they think that they have to have like some type of punishment for it, so maybe that's when they yell at us, the narcissist, sometimes we yell back and that soothes them. They're like, yep, I just got yelled at because that's what I was missing from my childhood. And it's odd. So the victims, this is something, the symptoms, it's just so sad. So it's good to get these abused away from their abuser. Sometimes there can be criminal charges, and we were talking about the famous different ones, and this is the one. There's Dee Dee Blanchard, and she had a daughter, Gypsy, who she kept in a wheelchair. And she claimed that Gypsy had leukemia, muscular dystrophy, all different kinds of things. Oh, she did. Okay. In 2015, she did kill her mother. And I'm going to go deeper into that. There's another one in 2013. That's just Blanca Montano. I'll get into some more of the different ones, but they'll often need cognitive behavioral therapy to change, family therapy, group therapy, all the different related things. So they're rare, but they're extremely serious disorders. And just, we need to protect people. So just look out for it, and don't ever let anybody ever control you like that. Sometimes they use poisons on people to where they don't even realize what's going on. And it's just for their attention. So sometimes you think like something is wrong with me, like my stomach's upset all the time, or I have diarrhea all the time. And it's something that they're putting in your food. And it's all for their, hate to say it, it's the worst word in the world to say, it's for their benefit. Mental illnesses are very destructive. Please like and subscribe. Let me know if you have any topics, and one-on-ones are available.